Welcome. This is going to be an overview of the Health for All Washtenaw website. This tutorial is going to provide a rather broad overview of the site, ranging from what information is on the site to an overview of how to access specific pieces of information on different areas of the site. So jumping right in, starting with what exactly is the Health for All Washtenaw website and what purpose does it serve? The site can be accessed by navigating to healthforallwashtenaw.org, which is the link shown at the top of this slide on any browser. It is worth noting that while this site can be accessed on a mobile device, some of the information and site features don't display as well on a mobile device, so that is something to keep in mind as you explore this site on your own. Health for All really serves as a central location for information about health and factors that influence health in our community. The emphasis of the site is on data, stories, and action, so the site houses an array of data that is Washtenaw specific, stories related to influences of health across the local community, news articles about local actions taking place to impact health, and so forth. Anyone across the community is welcome to use this site to access local information that they are seeking, including but not limited to students, researchers, community members, and organizational partners. Just to name a few examples of ways we have seen the information on the Health for All site used in the past. For instance, we have heard that community members on certain advisory committees have pulled specific information from the Health for All site to support decisions about policies. There have also been students engaged with a variety of projects spanning across various topic areas that have been able to pull information and add that information directly from the site into research papers, as well as local nonprofit organizations that have extracted information to assist with the grant writing processes. We also like to mention that your voice matters, and one of the great things about this site is that it's highly adaptable, so we are always looking for ways to make all components of the site, from the data to the stories and the actions, more representative of all across our community. For instance, some community members had approached us about having a central location for health data specifically related to the Whitmore Lake and Northfield Township area, so a dashboard specific to that area was created and now lives permanently on the site. We will cover dashboards a bit later, but I wanted to mention that to emphasize that the site is really ever evolving, and we are always looking for feedback. Next, I just wanted to mention the Community Health Assessment, Community Health Improvement Plan process that is taking place right now. On this slide, there is an image of the CHA chip cycle, which some of you may already be familiar with. This is an approximately 5-year cycle overall, with most of the time spent in the action phase, and we have already completed the planning, community health assessment, and prioritization phases. The top 3 health priorities that arose from these first 3 phases were mental health, healthcare access and navigation, and access to healthy foods. We are currently moving into the 4th phase, which is the Community Health Improvement Plan phase, which is to be followed by the action phase. So how exactly does Health for All tie into the CHA chip process? Health for All serves as a virtual home for the data, stories, and actions that are a part of that process. As I mentioned, we have finished the community health assessment process, and all of the information related to that process now lives on the Health for All site. So this is what the community health assessment page on the Health for All website looks like. At the top, there's a bit of background information on the process, and below that we have a status update as to where we are at in terms of kicking off the Community Health Improvement Plan part of the process. If you keep scrolling, you can find links to additional data, information related to our 3 priority areas. So here we have some findings and highlights that are relevant to each area. So if we click on the mental health section, then we can see relevant data, some of the information that was collected throughout our community health assessment process, some quotes, and like I said, additional data. And then that's available for the other top 2 priority areas as well. Below that, there are 3 buttons with additional CHA materials. So if you're interested in diving into our local demographics, the methodology that was used throughout that CHA process, and certain data on disparities, those buttons connect to that information accordingly. Then we have a link to the CHA executive summary, which really just summarizes the CHA process, the data that was collected, and the findings that arose from that. Then we have the COVID-19 snapshot, a summary of our primary data, and a summary of the community survey results that we had collected with that CHA process. These appendix buttons correspond to that information, so you're welcome to explore these as well. So to provide an overview of navigating the site, there are 4 main tabs on the homepage, and I'm going to cover what information is contained within each tab. There's a lot of information on this site, so if you're seeking specific information, hopefully this will help to provide a general sense of what location to look in. The 4 main tabs on the homepage are Explore Data, Resources, Get Involved, and Site Information. Looking at the Explore Data tab first, I previously highlighted the Community Health Assessment page, which is the first selection under this tab, and we will return to the few pages below these in a bit, but I also wanted to highlight the State of Our Health 2023 page, which is the 5th linked page on this tab. This page contains all of the information from our State of Our Health event that was held this past fall, including the data slides that were presented and additional data from our CHA process related to the top 9 health areas that were associated with that process. So if you're seeking any additional data related to these 9 areas, this is a great place to look for that as well. In terms of the information that is available within the Resources tab, I wanted to highlight 2 of the pages in particular. The first link page is Funding Opportunities, and this page provides an array of funding opportunities that are not all-inclusive, but a rather expansive list of existing funding resources that may be worth exploring for anyone who is involved with an organization who may be seeking funding opportunities, for instance. I also wanted to highlight the second link page, which is the Health for All Stories, which is a great archive of stories that capture different ways that community members and organizations are making an impact spanning across various areas of local health. The third tab on the left of the homepage of the site is the Get Involved tab, and this is where anyone visiting the site has an opportunity to receive email updates and or stay involved with local community health improvement work. The last tab, the furthest right tab is the Site Information tab, and this is where you can find general information about the site and how to use the site. There's also a link to a short informational video about using the site that is also available in Spanish. So to show you exactly what this looks like on the site, we are now on the home page of the site, and we can see our 4 main tabs. Towards the top, we have our Explore Data tab, Resources, Get Involved, and Site Information. Then we have our main scrolling banner here, as well as our search bar, and then 3 sections for data, stories, and action, and links to relevant information across the site that are related to each of those areas. So going back up to our Explore Data tab, I know I had already highlighted the Community Health Assessment page where all of that relevant CHA information lives. And then going down, we have our State of Our Health 2023 page that I had mentioned. Again, this just has a link to the data slides that were presented at that event, as well as some of the data related to those top 9 health areas that came up throughout our community health assessment and the information that was shared about those throughout those breakout sessions that took place at that event. Moving on to our Resources tab, I had mentioned those funding opportunities, so if we click on that page, we can see that there are a variety of funding opportunities here that are linked, and they are also categorized by health topic. So for instance, we have funding opportunities related to cancer, children's health, healthcare access and quality. So if that's something that interests you, this is a great place to explore those opportunities. Below that, we have our Health for All stories. And again, this is just an archive that really showcases all of the great work that has been happening across the community to improve health. And again, this third tab is where you can go ahead and sign up for email updates if you're seeking more information that's shared from the health department and the work that is being done. And lastly, we have our Site Information tab. Again, if you are interested in watching that short 5-minute video that kind of summarizes how to use the site, go ahead and click on that How to Use This Site page. Scroll down and below how to use. This video is available. Again, it's just a short 5-minute overview, so if there's questions you have, they might be able to be answered through that. Next, we will be going over indicators. So we're moving into focusing on the portion of the site that is more heavily focused on data. First, we just wanted to acknowledge a few of the data limitations associated with the site. One of the wonderful features of this site is that it really is a central location for so much different health-related data from so many different sources. However, most of the information on this site comes from sources beyond the health departments. We are not the owners of the information. That said, there is certain information such as zip code or census tract level data or additional specific demographic breakdowns that may not be available for some of the indicators if it is not available in the source dataset. Additionally, it takes time for valid and reliable data to become available. Therefore, some of the most recently available data may be a few years old depending on what indicator you are looking at and the source of the particular data. So first, what is an indicator? This is a broad term for a piece of information that describes an aspect of a population and is used to measure health or quality of life. The graphic on the right-hand side of this slide comes from the county health rankings, and we wanted to highlight it here because it provides a nice illustration of different aspects of health that are incorporated into the site. This graphic has 3 main components that each flow into each other: policies and programs, health factors, and health outcomes. And a lot of the times when we think about health data, it's natural to think about health outcomes, which is the component at the top of this graphic. Health outcomes branches out into 2 components: length of life and quality of life. We certainly have indicators related to these areas of health outcomes on the site, such as life expectancy, cancer incidence rate, and adults with diabetes. But the information expands much further beyond this, and looking at the second component, health factors, we can see that this branches out into 4 additional areas that tie into the information that is available on Health for All. So there is also information on the physical environment, such as annual particle pollution, social and economic factors like households living below poverty level, clinical care-related factors including adults with health insurance, and health behaviors, such as adults who binge drink. So we really wanted to highlight this graphic to demonstrate how the information really spans across many areas of health and well-being. So you may be wondering, with so much different health-related data on the site, how exactly do I locate something that is of interest to me or my work? The first method is to use the search bar that can be found in the middle of the site homepage and enter one or more keywords that are relevant to the information you are seeking. The second method is to make use of the All Indicators by Location page under the Data tab. This will bring up a page that lists all of the indicators categorized under the relevant subtopic on the left, and each listed indicator will have check marks that correspond to the geographic levels at which it is available, such as the zip code or census tract level, depending on what is available in the source dataset for that indicator. The third method is to make use of the Find Health Data page that is linked below Data towards the bottom of the homepage. This allows you to see all 150 plus indicators in the most recently available Washtenaw value on one page. Though using this method and scrolling through all the indicators in this format may not be the most efficient if you're looking for a specific piece of information. To demonstrate what these different methods look like on the site, here we are on our homepage, and let's say I was interested in looking for data related to disability. Using the first method, I could scroll down to the middle of the page, locate the search bar, and type in our keyword, which is disability, hit enter, and relevant results related to disability will come up. Here we have our top results, and if you're wanting to look at all matching indicators, you can scroll to the bottom and click this See All Matching Indicators, and then it'll pull up everything that the site perceives as relevant to that. Using the second method, we could go up to the Explore Data tab, select All Indicators by Location, second selection, and scroll down. Again, these are categorized by subtopic, so we could keep scrolling until we find Health/disabilities. So again, these are an array of indicators that are related to disabilities. And on the right here, we can see the check marks that indicate which geographic levels those indicators are available at. So, for instance, we're looking at our top result here, which is adults with disability living in poverty. And we can see that that information is available at the county level, at the census place level, at the zip code level, and at the census tract level. And using our last method, we could navigate back to the home page. Scroll down to where we see our data, stories, and actions headers. Select Find Health Data. And again, this takes a little bit longer to scroll, but we could just keep scrolling or use the search bar to find disabilities. And this is going to show you the most recent data value at the Washtenaw level. And then we're going to cover what these symbols mean shortly as well. Okay, so what information is conveyed by each of these indicators? Just to give an overview of the layout that is consistent across all indicators on the site. So first you'll see the title of the indicator that summarizes the information being displayed. Then you will see a location, which is where you can switch if additional geographic information is available beyond the county level for that indicator. And you will also see the measurement period that you are looking at being displayed there as well. This is followed by background information that provides additional, more specific information about the information that's being displayed beyond just the title. So that might include population details, additional details about how the data was collected or measured, as well as a box that says, why is this important? And that provides additional insight and broader level context on the importance of that information in the broader context of health and well-being. Below that, you will see a variety of colorful symbols, and those are the targets and comparisons, and we'll come back to those and cover what information those are conveying shortly. Then you will also see data associated with that indicator. There will be a value for that specific measurement period in the upper left corner, and then on the right, there will be a chart that shows the data across all time periods that are available for that indicator. At the bottom, the data source will be listed and hyperlinked, and related content will be below that. So to go through each of these components in a bit more detail, again, at the top, you'll see the indicator title. This is just a really brief summary of the information being shared. So in the example shown on this slide, the title is Adults with Health Insurance. Again, that doesn't really tell us how they're defining adults or having health insurance. It's just a pretty broad level overview. Below this, we see the location. So in this example, the county level Washtenaw is selected and the measurement period selected is 2022. However, right next to each of these selections, there is a blue caret. And if you select the blue caret there, then you can go ahead and select a different measurement period or a different geographic location to look at if that is available for that indicator. Then we have our background information. Again, this gives us additional details about that data beyond just that overall title. So in the example on this slide, it's telling us that the specific population that we're looking at in relation to adults that have insurance is, it's defining that adult population as those between the ages of 19 to 64 years old, and as having health insurance as any type of health insurance coverage. Again, this is followed by additional details, additional context on why this is important in the broader context of health and well-being. And then we also have our targets and comparisons. As I mentioned, these are just a bunch of different colorful symbols that can feel a little bit daunting to try and interpret at first, but there are some strategies that the site uses to really help with that. So again, these are just really a comparison of the measurement period that you're looking at, that may be comparing to a prior value, to a comparison value, such as the Michigan state value or national value, or a target, for instance, if there's a target value for that indicator. So again, like I mentioned, these can feel a bit daunting at first. There's a lot of different colors, a lot of different symbols going on. So one strategy that you can use to help understand what these symbols are telling you is to just hover over any of the symbols as they're on the site. Hovering over them will provide you with a pop-up that gives some additional detail and like the context of what that comparison is telling you. Another method that can be used is when you're looking at an indicator, you'll see a box on the left-hand side that says see the legend. It's a blue box. If you click that box, then it will expand into another pop-up. Again, that just tells you additional information about these comparisons to help interpret what they're telling you. Next, looking at the data and charts for an indicator, as I mentioned, the top left is going to display the value specific to the location and measurement period selected, and the right-hand side will have a graph that shows the data over the measurement periods that are available for that indicator. There are additional chart options that can be adjusted by selecting the panel icon that looks like 3 stacked lines in the upper right corner of the graph, and this allows for options to export the chart or to change the view of the chart, such as enabling zero-based y-axis. So I have a screenshot of that here. Again, you see this panel to expand in the upper left corner. You have options to export that chart and then also chart options to change the view of the chart. So for instance, this chart is starting at 94, and if we wanted that y-axis to start at 0, we could select enable zero-based y-axis. Again, at the bottom, there is the data source for the indicator. This is hyperlinked, so you can navigate directly to the source of that data if you're seeking additional information, as well as there will be any relevant data notes below that. Related content will be at the bottom-most portion of that page. That will contain information such as related indicators, links to related work in the community, and so forth. Next, I'm going to go into 2 specific examples to kind of give you a sense of what indicators look like on the site, how the layout is similar, and some of the differences as well. So we're going to start out with life expectancy. Again, I'm going to navigate over to the site and show you what this looks like, but this is an example of an outcome-related indicator that has some more specific demographic breakdown for the data. And then I'll also show what the income inequality data looks like on the website. This is an example of more of a factor that influences health rather than an outcome. And it's also an example of an indicator that has more specific geographic level information. So now we'll navigate over to Health for All. So here we are again on the home page of Health for All. Say we're wanting to look at that life expectancy indicator. We can just type that into the search bar, hit enter. And here it comes up as our first result, so we can just go ahead and click into that indicator. And on this page, if there's a different additional geographic information, you'll be able to see and click which option you would like. So we're going to go ahead and look at this at the county level. So now that we're into our indicator, we can see our title at the top. Again, that's life expectancy. We can see that we're looking at this at the Washtenaw County level. But again, because this information is available by census tract as well, if we had a specific census tract of interest, we could go ahead and switch that here. And then the measurement period is between 2019 and 2021. Again, we could click that caret on the right and switch this to a previous measurement period as well. Again, here's our background information with additional details about this indicator and then why this is important in the broader context. Scrolling down on the top left, we can see that this displays the county Washtenaw as the location, and we can see a value of 80.4 years with our measurement period of 2019 to 2021 listed below that. To the right, we have our symbols here, so we can see how this compares the Michigan counties, U.S. counties, and then the Michigan and U.S. rate as well. So these are a comparison to distribution, and we can see that by hovering over those, and then additional context by hovering over these symbols as well. Again, like I mentioned before, on the left, we have this See the Legend tab. You can go ahead and open that. And again, this is just providing additional context to those comparison symbols as well. Scrolling down, we have our main chart here. We can go ahead and hover over each of these data points for the previous years to see the data values for those points. And like I had mentioned, this panel on the right, this is an opportunity to export this information as well as adapt the chart. So for instance, we can see that the y-axis currently starts at 80. If we wanted to enable zero-based y-axis, we select that, and the chart will then start at 0 for the y-axis. Then scrolling down, we can see that this is an example, as I had mentioned, of an indicator that has additional demographic breakdowns. So we can see our race and ethnicity breakdown for this indicator as well. And this has the same option to export into a JPEG, PDF, or CSV. Then moving into our next example, which is income inequality. And this is an example of an indicator that's more related to a health factor that influences health rather than an outcome. And so if we click into that indicator, on the front here, we can see that, this data is available at the county level, the census place level, the zip code level, or the census tract level. So we can go ahead and select the zip code level for this example. Again, we can see the same information at the top, which is our title. Again, because we selected zip code, we can see that here. This is also another way to select a specific zip code if there's one in particular that you want to isolate that information for. And then again, same thing with our measurement period and our background information. Because we're looking at this at the zip code level and we're looking across all of the zip codes of Washtenaw County, we can go ahead and see that there's a map displayed here as well as a chart next to it. And these just contain the same information in a different way. So you can go ahead and hover over zip codes across the map and it'll give you that specific data value for the particular zip code. And then same thing with the chart on the right here and the same options to export as well. So this is an example of an indicator that has, a variety of geographic information available. So this is a great one to explore if you're looking for an example of that. I just wanted to emphasize again that the graphs and charts can be exported directly from an indicator into a JPEG, CSV, or PDF. So you can pull that information directly and use it however you see fit. Pull it into CSV and kind of customize it to your own specific needs. So that's an option that's available throughout these indicators as well. Now that we've covered indicators, we wanted to talk a bit about dashboards since there are a way to pull together a variety of different indicators and have them all in one location. So that's really a great feature of the dashboards that we have available on the site. There are several dashboards that are pre-built and live on the site, and these can be accessed through the Community Dashboards page, which is the third link down within the Explore Data tab. When you enter one of these dashboards, you will see the most recent data value, any associated comparison symbols, and demographic breakdowns of each indicator that is relevant within that dashboard. You can also click into specific indicators from within a dashboard, so that's another way to navigate the site as well. The pre-built dashboards on the site contain information related to county demographics, disparities, specific populations such as seniors and Latinx population, location-specific dashboards like the Whitmore Lake and Northfield Township dashboard that was mentioned earlier, and so forth. So to give an example, let's navigate back to the site and I'll show you the social determinants of health dashboard. So starting from the home page of the site, we can go to the Explore Data tab. And again, our pre-built dashboards live within the Community Dashboards page. And then if we scroll down, we can see all the dashboards that are available here, and we'll go ahead and click into the social determinants of health dashboard. As you can see, these are all of our indicators that are related to some of the social determinants of health, and they are classified by subtopic. So you can scroll through these. Again, these data values here are the most recent data value for each of these indicators, and then you can go ahead and look through the comparison values as well. So again, this just really pulls together an array of indicators that are somewhat related in one central location. So that was our social determinants of health dashboard. There are also options at the top of the dashboard to change how you're viewing that. So automatically these will populate to viewing them at the Washtenaw level. You can also go ahead and select that caret. There's a green caret right here, and you can change the location that you're viewing that dashboard for if that's available. And then you can also change the view from card view to list view if that's something that you're interested in, as well as there's colorblind mode for these as well. There's also a way to create your own dashboard and pull together a variety of indicators that are of interest to you. So to do so, you can navigate to the Explore Data tab and select the fourth page down right below Community Dashboards, which is Build Your Own Dashboard. When you do so, you will see that you can filter by location, topic, population, classification, comparison, subgroup, or source. You can also select multiple filters this way. Once you select your filters of interest and customize the information you're looking for, the dashboard will populate with the relevant indicators, similar to the display that I showed you with the social determinants of health dashboard. So selecting from our drop-down, again, right below the community dashboards, we have a build your own dashboard selection. And here's what the filters will pop up and look like. You can kind of scroll through here and kind of take a look at the different options that are available if there's something that you're interested in exploring in one concise location. So to provide an example, let's say we're interested in locating information related to women in the Ypsilanti area. So one way we could do this is go ahead and select the filter by locations selection and scroll down. We could select our 48197 and 48198 zip codes, and then we could go down to populations and select women. And then we have our selection, so we go ahead and hit search. And then all of the relevant information populates, so we can see the related indicators, and then they'll display for each of the zip codes that we have selected. So again, you can make multiple selections to really customize this information to exactly what you're looking for, and it just is a really nice way to see a variety of indicators in one concise location. And that is all for this overview of the Health for All Washtenaw site. On this final slide, there is a link to an anonymous feedback form, and we invite you to share your thoughts on this session. We also encourage everyone to take some time to explore the information on this site that may be relevant to your own work and/or personal interests. We truly hope this was helpful, and we really appreciate you taking the time to learn about the Health for All site and all of the great information that is available about the local community. Please don't hesitate to reach out with any questions that come up as you're exploring the site or any questions related to this tutorial session. Thank you so much and take care.